All right, the next group is a panel: Amy Grunder, Damaris Velasquez, and Melissa Caro Jimenez, here to talk about Cover All Kids.
Good morning, everyone. Thank you, Chair Lawn and Chair Friedman, for the opportunity to testify today on behalf of the Massachusetts Immigrant and Refugee Advocacy Coalition in support of Cover All Kids. My name is Amy Grunder, and I direct state policy and legislative affairs at MIRA. I'll just cut to some of the things that haven't been said today. So you've heard about the serious gaps that remain for tens of thousands of low-income children without status in particular, because they have to rely on this patchwork of programs that severely limit the care that they can get. And one of the principal places that these children do receive care are the community health centers. I just learned yesterday of one health center that had an 8-month wait for taking new patients. The healthcare shortage being the physician shortage.
She's not the only person this happens to. She happened to have a good support network, but there are people who don't and who face not getting services in hospitals because they have nowhere to go when they come home. There are people stuck in nursing homes because there are no home care services available. So there are thousands of people, older people and people with disabilities who aren't getting the services they need. And there are thousands of people doing this work who don't get this money they need to live decent lives and even stay in their homes. So this bill is part of the solution. You have many bills before you that address this, and I hope you will consider it as you move forward with so many important issues. Thank you.
Thank you, Senator. Appreciate your coming. All right, the next group is a panel: Amy Grunder, Damaris Velasquez, and Melissa Caro Jimenez, here to talk about Cover All Kids.
Good morning, everyone. Thank you, Chair Lawn and Chair Friedman, for the opportunity to testify today on behalf of the Massachusetts Immigrant and Refugee Advocacy Coalition in support of Cover All Kids. My name is Amy Grunder, and I direct state policy and legislative affairs at MIRA. I'll just cut to some of the things that haven't been said today. So you've heard about the serious gaps that remain for tens of thousands of low-income children without status in particular, because they have to rely on this patchwork of programs that severely limit the care that they can get. And one of the principal places that these children do receive care are the community health centers. I just learned yesterday of one health center that had an 8-month wait for taking new patients. The healthcare shortage being, the physician shortage being another problem. So that's just one thing to mention. The other thing that was mentioned was regarding numbers. So meanwhile, in Massachusetts and elsewhere, immigrant children are the fastest growing segment of the US population, and immigrants in Massachusetts are the sole source of population growth in the state right now. And the numbers of uninsured children are increasing. The unprecedented influx of new immigrants who began arriving in the fall of 2021 continues to grow, with a fresh uptick of new arrivals beginning early this summer, both from the border and from other states like Florida, New York, and New Jersey. Reportedly, the majority of these new arrivals were families with young children. There are unfortunately no state statistics available because the state has not yet found a means to track new immigrant arrivals. However, one of MIRA's frontline organizations served 2,000 new Haitian arrivals in June alone. Another, and they expect the same for July, another recently designated as a state welcome center has reported serving 1,346 arrivals, including 436 families in their first month of operation. That's from June to July, end of June to end of July, 22nd. While many, so we're kind of witnessing a perfect storm here. And while many newly arrived immigrant children do have access to fairly comprehensive medical care based on their entry status, if they have parole as Haitians or Venezuelans, but many do not. This is especially true of asylum seekers and their children who are treated as undocumented immigrants without lawful presence under state law until they are able to file an asylum claim with the help of a lawyer, which can take months. If they are able to even secure a pro bono lawyer, there's another shortage. These children often need access to mental health services as well after undergoing the trauma of a harrowing journey of months, or in some cases years, to get here. I'd also like to note another reason this passage of this legislation is important, and that's because it would simplify complex eligibility requirements that limit access to medical care for immigrant children who are already eligible for more comprehensive coverage by reducing their erroneous and unfortunately quite common misclassification as eligible only for mass health limited emergency services. Massachusetts has come very far in the last few years in making our Commonwealth a truly welcoming state for all immigrants, regardless of status. And we now have an opportunity to address persistent and I would say growing inequities in healthcare access for these populations and achieve universal healthcare access for children, as 8 states and Washington, D.C. have already done, and advance our stunning achievements in reducing the ranks of the uninsured and underinsured in Massachusetts. For all these reasons, we respectfully urge this committee to issue a favorable report for the Cover All Kids Act without delay. Thank you so much.
Good morning. Oh, it's on, yes. Good morning, Chair Freeman and Chair Alon and members of the committee. Thank you so much for giving us this opportunity. I'm Damaris Velasquez. I'm the Director of Programs of Agencia Alpha. Agencia Alpha is a faith-based organization in Boston. And for 21 years, we've been working with the immigrant community, providing legal assistance. But it wasn't until COVID, like everybody else knows, we all had to get involved in the healthcare system. I'm here to speak on behalf of my community, not only as a person who has been working for 21 years listening to the needs of our community, but also as a former undocumented woman who was undocumented for 22 years. And I'm here because we are supporting the Cover All Kids Act. But I also am here with the youth group that we have this summer. We have a youth group every summer. And because I also want them to see how democracy take place in a place like this. So very quietly, I'm gonna ask my youth if they can just stand up quietly, showing our respect, so you can see them all. Many of them were here last summer supporting the driver's license or the Family Mobility Act. And they're very happy this summer to know that now they're helping our community to get ready to apply for the driver's license for the first time. Thank you guys, you can have a seat. So I'm hoping that next year when we come back, we can celebrate this victory as well as we're celebrating the other victory. But I'm here because we believe that if we invest in our community, regardless of where they come from, regardless of how many years they've been here in the States, if we invest in our community, they can bring back so much to our society. When we first started helping the DACA recipients, we didn't know what was going to happen. But I can tell you that many years after, every time that I renew a DACA in my office, I am so proud to see that they are doctors, they are lawyers, they are teachers, they are perfect senior residents of this society. And I am so proud to see that happening. So I believe that if we invest, yes, at the beginning it might sound like it's a lot of money, but at the end, when you invest in a human being, the results can just multiply, and we cannot imagine how much that will cost at the end. I'm also here with one of our youth leaders who had the passion to stand up on behalf of all of those young kids that you can see sitting down there and share her own testimony. Thank you.
Good morning, Chair Friedman, Chair Lon, and members of the committee. My name is Melissa Caro Jimenez. I am a 19-year-old Colombian American citizen, and I feel incredibly proud to represent Agencia Alpha with my testimony today. I'm thankful for the opportunity to testify in support for the Cover All Kids bill, but mainly to speak on behalf of the countless number of voices, both documented and undocumented youth, who can't be here with us today to share their own stories. I have lived with Crohn's disease for half my life. My illness is debilitating, it is progressive, and there is no cure. Learning to cope with my Crohn's at such a young age has put an immense amount of pressure and stress on my mental health. However, I am just one of the thousands of youth who are enduring the pain, exhaustion, and instability that comes with living with illness. Being denied healthcare due to lack of immigration status or documentation is depriving youth from the treatment, recovery, and most of all, the hope of having both a healthy and successful future. Physical and mental wellness should not be defined by documentation. To give all youth the human right to equitable healthcare regardless of their documentation or immigration status is to give each individual the hope for a life that isn't defined by their illnesses, but rather one that they can shape into a happy, healthy, and successful future. I urge you, as my elected representatives, to listen to the voices of your constituents and support Cover All Kids. This bill is necessary if the state of Massachusetts wants to ensure the long-term physical and mental wellness of all youth. Every young individual in Massachusetts, regardless of their immigration status, should have the opportunity to fulfill their dreams and carry out their passions by having access to equitable health care. Thank you for your time and consideration of this important issue.
Thank you, Melissa, for your testimony. Welcome to all of you as part of the youth group. Thank you for being here. Seeing you all and listening to you is a very, very strong reminder of what many of us have come here to do. And it's just deeply, deeply disheartening that we have to have a conversation about taking care of children and taking care of elders. It's just deeply disheartening. So I just want to thank you from the bottom of my heart that you were willing to come here and that you persevere and that you're being part of a system and trying to change it. You really make a difference. Any comments, any questions? The next panel is Dr. Claire Cecile Pierre, Vasti Lopez, and Dr. Fidelito Gabriel. And you are here to talk on behalf of Cover All Kids.
Good morning, Chair Friedman, Chair Lon, and members of the committee. My name is Claire Cecile Pierre. I'm a physician. I am also the Vice President of Community Health Programs at Mass General Brigham, and I'm a member of the Health Equity Compact. Thank you so much for the opportunity to testify in support of House Bill 1237 and Senate Bill 7440, an act to ensure equitable health coverage for children, Cover All Kids. This is important to me from my lived experience as an immigrant from Haiti, but also from my professional experience training and working in different healthcare settings across the United States and in Massachusetts. You know, active play has been shown to improve brain function, to support social and mental health well-being, to increase physical wellness. But growing up in a mixed immigration household, we were told that we were not allowed to be sick. As children, we avoided all risks. So no climbing, no running, no bike riding. The swing, which is often a sign of joy for children, was nearby, but it was out of reach. When we accidentally fell ill, call it cold, we suffered twice. We had the pain of hiding our illness and the pain of feeling guilty for getting sick. As a physician, I spent many years working in different settings at the Cambridge Health Alliance, at the community health centers across Massachusetts. And I worked with committed and dedicated nurses, community health workers, social workers, who navigated this incredibly difficult system of limited coverage for these children. It was painful to hear the endless stories of misdiagnosis and delayed care, and to watch the additional cost of emergency room and hospital visits. Separating access to care for children whose families have come to the United States to seek safety, as well as work or educational opportunities, is not only a health equity issue, it is an issue for the health and well-being of our communities. While the Health Equity Compact strongly suggests coverage and access for everyone, regardless of their immigration status, today I'm specifically expressing support for making sure our children have the same care they need to thrive. On behalf of Mass General Brigham and the Health Equity Compact, I ask you to support this bill. Thank you.
Good morning, Chair Friedman and Chair Lawn, and other members of the committee. My name is Fidelito Gabriel. I am the Clinical Director at Brockton Neighborhood Health Center. Thank you for the opportunity to express my support for the Cover All Kids House Bill 1237 and Senate Bill 740. I have been a practicing general dentist for over 18 years. I'm comfortable performing most dental procedures on adults and children. My skill sets and scope of practice are what you would expect to find in dental providers working at the community-based health centers. All right, thank you. Dentists working at health centers enjoy caring for the underserved patients because we know we are the last hope for quality dental services, which most of them desperately need and cannot afford. It may be my experience, but I doubt this is the case. In the 7 years, my patient panel has been growing with patients who have limited insurance. At Brockton Neighborhood Health Center, we try our best to provide comprehensive care for all patients. However, we are failing the children who have limited health insurance. Children tend to be scared of dentists at the point where they cannot behave or cooperate with instructions that would allow safe delivery of dental care in the general practice setting. Young children with difficulties at general offices need referrals to a higher level of care. They need dental care at a specialty office where they can be treated under general anesthesia. Most specialty offices do not accept limited health insurance because limited coverage cannot cover for specialty services. Therefore, most of the young children on limited health insurance do not receive appropriate dental care to address their oral health needs. The majority of these children with limited health insurance are immigrants with poor oral health. It is disheartening to us, dental providers working at the health centers, to see the children over and over for dental emergencies without being able to help them. We generate specialty referrals we know that are going nowhere to where these children can receive the appropriate care. Parents cannot afford to pay for their care at the specialty office. Cover All Kids will extend standard mass up to these young children, which will help them tremendously with the care they need at the health centers. I thank you for your time.
Hello, good morning. Honorable Chair Lon, Chair Friedman, and other members of this committee. My name is Vasti Lopez Chavez, and I am currently working for Brockton Neighborhood Health Center for about 10 years now. Currently, my role is the Dental Administrator Director. It has been my personal and professional experience to witness how our patients with Health Safety Net, Mass Health Limited, Children's Medical Plan, particularly our children, have and are facing barriers to equitable health access, particularly in dental. As a manager and dental administrative director, I have to face daily working closely with parents whose children are in need of dental referrals to other specialties. Our dentists, as Dr. Gabriel just mentioned, go above and beyond, overloading their panel a day to ensure that our children that we understand have limited health access coverage can receive the most coverage at our health center. But this is not always possible where certain treatment plans require referrals. As Dr. Gabriel just explained, process and referrals most of the time get stuck. I have worked closely with our dental pediatrician at a local area in Brockton, visiting their practices to learn what barriers our patients are facing once we refer them. Some of those barriers expressed are that parents can't afford to pay for an extraction or for a filling, not to mention afford transportation to get there or afford to stay out of work. This is disheartening to me, particularly because I myself, 20 years ago, arrived to this country at the age of 12 as an immigrant whose visa expired while still being a minor, who I also had to witness closely, my siblings and I having to hide our sickness, our pain, toothaches, skin rashes because of the concern that can my parents afford taking me to a specialty? Can my parents afford the extraction of my tooth? And I can take one more Tylenol, mom and dad. I think I can bear the pain an extra week. So watching that at a personal experience and professional experience is very disheartening, knowing that we are in a wonderful country where I came here with the dream that this country would overcome any potential barriers that my family and I experience abroad. Now living proudly in Massachusetts, and I thank you leaders for sitting and listening to us today to continuing advocating for health equity and overcoming barriers. Our children are our future. And Massachusetts has been the leading state with health access. I encourage you to please continue supporting our children and preventing from immigration status being the barrier to basic health access. Let's build our children healthy to a brighter future. Please, I implore you today for supporting and passing this bill for Cover All Kids. Thank you.
Thank you very much, and thank you for your service to the Commonwealth. Greatly appreciated and incredibly important. Eloisa?
Yes. Thank you. Good morning, Chair Friedman, Chair Sloan, and members of the committee. My name is Eloisa Galvão. I am the Executive Director and co-founder of the Brazilian Women's Group. We are a 28-year-old community organization that defends immigrants' rights and organizes the community to have its own voice. Thank you for the opportunity to testify in support of Cover All Kids, House Bill 1237 and Senate Bill 740, an act to ensure equitable health coverage for children. As an organization that works directly with immigrant families, this bill is very important to us. When COVID happened 3 years ago, we all got by surprise. Nobody, even the doctors, knew what was happening. And organizations like the Brazilian Women's Group right away knew they have to get a hold of the community, inform the community, and provide any kind of support and services that they needed to fight the coronavirus. We know what happened to the immigrant community. They were the ones that had to be in the forefront doing business because afford not to work, but they were also the ones that got sick first and died. Now, with the end of the COVID emergency, what happened is that many families are losing their health care and the kids go with it. We have a case of a child, 4 years old, got sick one morning. Mom called the pediatrician. This was less than a month ago. Mom called the pediatrician who knew the kid, and she said, that's what is happening. And the pediatrician said, I can't see this child because her health plan changed. So what do you do in that situation? What do you do? Like I have a 15 years old girl who had gone through horrific abuse. She needs health care. She needs mental health. And we are offering to pay for a few sessions with a psychiatrist who is culturally and linguistically competent to help this youngster, because she doesn't have health care at the moment, or the health care that she has doesn't cover that. So this bill is so important because what we expect from the new generations, if we don't help the kids, if we don't help kids, if we don't provide at least health care for our children. So I use this committee, please, to pass this bill, to send this bill forward so we can have a generation of healthy kids and families. Thank you.
Thank you. Are there any questions, comments? No. Thank you very much. Thank you to the panel for testifying.